Okay, next we're going to hear from Dr. J. Mark Ryan with Physicians for National Health Program, the Rhode Island Chapter.
Good afternoon. As you just heard, my name is Mark Ryan. I'm a physician. I've been practicing in this state for the last 30 years. I'm also the chair of the Rhode Island Chapter of Physicians for National Health Program, a nationwide organization of more than 20,000 doctors who are advocating for single-payer national health insurance, Medicare for all. We're all here because we understand what many of our elected leaders either do not understand or refuse to acknowledge. As has already been said, our healthcare system is badly broken, and it's only going to get worse. Despite paying nearly double what the citizens of any other industrialized country pay for their healthcare system, our healthcare outcomes are poorer than any of those countries. And we have unintended results of our healthcare system that are not seen in other countries. The purpose of a healthcare system is to provide care for people who are sick. The American healthcare system provides three other things: misery, suffering, and death. How does it do these things? First of all, our system is based on the ability to purchase and afford private health insurance. For those who are not insured, and that is 30 million of our brothers and sisters in this country, there's a mortality rate. People who do not have insurance delay getting care. We know they delay getting care because 30,000 of them are going to die this year because we can't fix this problem. And it's not surprising that they do, because the number one cause of bankruptcy in this country, over 60% of personal bankruptcy, is caused by healthcare costs. So when people are faced with the choice of making their families homeless and getting care for that weird chest pain they're having, many of them delay getting care. I know patients, I've had patients who've done this. So this is not a statistic, this is real human suffering. And by doing nothing, our elected leaders are allowing this to go on day after day after day. So people who are opposed to Medicare for all like to make the point that, well, it's really the healthcare we're providing is too expensive, which is nonsense. Americans go to the doctor fewer than the citizens of any other industrialized country. So it's not the delivery of healthcare that's expensive, it's the funding of healthcare. It's estimated by virtually every study that about 1 out of every $3 that's pumped into this healthcare system actually is diverted into insurance company overhead and profits and pharmaceutical company profits. Even the most conservative estimate, which was put together by the Mercatus Institute at George Mason University, which was funded by the Koch brothers, were forced to conclude that over 10 years a Medicare for all system would save the United States $3 trillion. Most other honestly done studies put that number 1 or 2 orders of magnitude higher. So what does this translate to as far as people's experience? A particularly appalling one is maternal mortality. Women in the United States die 9 times the rate as giving birth compared to women in Australia. And it's even uglier than that, because in the United States, women of color die 4 times more frequently than women who are Caucasian in this country. And is this some sort of genetically predetermined difference in health? No, it isn't. In a system where access is not determined by financial means, the Veterans Administration Medical Center system, which is essentially a single-payer system for veterans, African American men have lower mortality rates from heart attack and stroke compared to Caucasians. So these disparities in healthcare outcomes are all determined economically and racially. Our system is racist. It's far too expensive. I've already mentioned this, and it's only going to get worse. One of the things driving our costs, insurance company premiums have for the last 40 years increased by 5% per year, double the rate of inflation, and they have not come down. A couple of years ago, when former President Trump cut the Affordable Care Act cost-sharing reduction payments to private insurance companies, Blue Cross of Rhode Island responded immediately by increasing the rates of their ACA Silver plans 18% in 1 year, showing us that without direct federal subsidies, private insurance companies cannot offer insurance plans at anything even close to an affordable rate. The effects of this are devastating. What have our elected leaders done to address this? Well, in the last 7 years, our previous governor, in order to balance the budget, cut Medicaid funding twice, which resulted in the closure of Memorial Hospital because it had far too many Medicaid patients. Bad payer mix, as the insurance company people like to say. Those patients still need health care, so they are in the emergency rooms at Miriam and Rhode Island, clogging those ERs and delaying care for people who may need it. What other things has our wonderful government done? The Affordable Care Act, which we are told constantly is the salvation of our healthcare system, which in fact just pumps money into a system that doesn't work. In order to pass it, Democrats voluntarily cut billions of dollars in funding to safety net hospitals in order to make the entire plan more budget neutral and gain Republican votes. Not a single Republican voted for it. And now, our wonderful Supreme Court has decided to overturn Roe v. Wade. So is this a political issue? Well, it is, but it's also a healthcare issue. Studies have shown that in states right now that restrict access to healthcare, to abortion, maternal mortality rates are virtually double that in states that do not restrict access. So by getting rid of Roe v. Wade, we have the potential for doubling our already way too high maternal mortality rate. So I am very grateful to Senator Bell and to Representative Morales for proposing to do something about this. This needs to be done at the federal level, but it's got to get started somewhere. Rahm Emanuel's brother, Ezekiel Emanuel, came to talk to the Watson Institute at Brown a couple of years ago. And he made the point that, of course, if you had it to do over, you should get Medicare for all. But of course, we can't have it because the insurance companies won't let us. So if that is the situation at the federal level, until more people who are in federal office are willing to stand up and take a stand on this, then we have no choice but to proceed at the local level. And we have precedent for that. Canada did it that way. In 1962, the province of Saskatchewan, 1 million people, roughly the size of Rhode Island, initiated its own Medicare for All program for that province. They ran it successfully for 8 years, at which point the Canadian federal government could no longer ignore the success of the program, and they had to nationalize it. And Canada now has single-payer Medicare for All, what PNHP is advocating. If you look at the graph of how their healthcare costs have gone up, they have flattened out remarkably, while healthcare costs in the United States continue to climb at an appalling rate. So I thank visionary leaders who recognize the problem and are willing to do something about it. We need more people like them, and I thank them very much.